Welcome back to Laugh Through It All. I'm your host, Tracy. Join me as I talk to Dr. Renu, a pelvic floor physical therapist and owner of Soul Pelvic Floor Therapy in Rochester Hills, Michigan. We're going to talk about a holistic approach to pelvic floor and gut health. Can you describe what pelvic floor physical therapy is and why is it so important?
So I'll give you a little bit background about the journey, how
Yes.
I started as a pelvic floor therapist. I'm a orthopedic physical manual therapist, and I have been practicing for last 20 years. Unfortunately, I was in multiple car accidents. It has been few years now that I had like so much of back pain and then so much going through, and I was in physical therapy, but no one was able to tell me that why I'm still having pain. So that's when through my own journey, I discovered that it's not just, like my tension in my low back or musculoskeletal changes in my back or my hips and other areas, but it is also involved my pelvic floor. So that's how, like for pelvic floor therapy, how it is. We go through additional education from pelvic floor therapy perspective. So after, for being the doctor of physical therapy, that's why this is an additional for women's, and I'm a pediatric pelvic floor therapy. So what basically pelvic floor, coming to your question, is pelvic floor is, I'm just going to show my model because I love to, yeah, I have
Yes.
genes of a teacher. My grandma was a professor, my mom was a professor, so I'm always like educating with diagrams and everything. So this is what if you look at the aerial view, meaning if there is a camera above you, this is like the muscle, like a hammock of muscle, which is called as your pelvic floor. So this is a women's anatomy model. So there are a lot of different functions of pelvic floor, but if I have to just, give like the pointers, the one it keeps things inside, meaning the urine, feces, gas, and then it has the function to let things outside when we want to. Like when we have to go to the bathroom, we can urinate. When we want to have a bowel movement, we are able to have a bowel movement. When we are, have to pass a gas, then we should be able to. And then if we are in a public place where we don't want to pass the gas, then we should be able to hold. So both them, it's very important that it should able to like relax and it should able to hold when needed. Then the other important function, it is the support of all the organs. So you have uterus in the female, rectum, and bladder. So everything is like snug fit in this small space. So people have like, a lot of women, they have this diagnosis or they feel like things falling out of their vagina or they have rectal prolapse. So that's another big function of your pelvic floor. It just like think about it as a hammock. It just everything is like kindly nicely snug, and then it is it helps to hold everything where it belongs to. Then another important function is about the sexual health, that when I want to have sex, then I should be able to relax my pelvic floor. However, if I am anxious or I am in a fearful state or I feel that, oh, it's going to hurt, then most of the patients, what they do, they just like kind of go into their cocoon and then just like tighten everything. So like its function is to again, relax things when needed and then contract things when needed. And then it's also like an important, like our core starts from here. So it's an important part or like for your core. So, it helps with the stability. It helps with the So that's what, these in a nutshell, these are the important functions of pelvic floor.
Yeah, I don't think I realized how much the pelvic floor, had anything to do with having a bowel movement and everything else. That never even crossed my mind.
Yes, bowel health, I feel, bowel health is another close to my heart topic. In my house, like my kids and my husband, I would just ask, like, okay, are you girls pooping every day? And then there is a score, which is called as Bristol stool chart. So, everyone, you can look into Bristol, Bristol stool chart. So it talks about what should be the stool type. Are you in someone who is constipated, or it's like a banana consistency? That's how it should be. Or the fiber is lacking, or diarrhea. So constipation is like I can go on and on talking about constipation because that's another very important function of pelvic floor. If the muscles are tight, I have seen in so many patients that again, what they do, they try to like bear down as if they're pushing out and they're straining. So a lot of women, when they are like, pregnancy or postpartum journey, like taking iron supplements, which is very important, but at the same time, if they are not doing enough of hydration, and then through in some form, if the pelvic floor gets tight, then they are not able to relax the pelvic floor, and the bowels are not able to kind of, it just sits there. So that's bowel health and pelvic floor are very closely related.
Ooh, you're like just talking about my entire life, let me tell you. I mean, a little of everything. I had pelvic floor physical therapy when after I had had my son. So almost, well, yeah, 16, 17 years ago. And at that time, it was, I mean, I would say because my son had a very traumatic type labor. I did not have a good delivery with him. I ended up having fourth degree tear, and then I had to go in at another time and ended up needing surgery to repair. I had a fistula, between the two areas, and so they went in to repair that and found that from the fourth degree tear and everything in labor, my the wall of my perineum was tissue paper thin, and so they had to rebuild that wall. And so from all of that, I then had to, of course, have, do some physical therapy, and so much of it was breaking up scar tissue from all of that. So I mean, and to be quite honest, I don't remember, it's been so long ago, I don't remember the initial reason why they sent me to do that, but I know that it was so invasive.
Yes. So I'll tell you, a funny story. Now it has been, everyone, like a lot of people, they know about pelvic floor, and then they know that, it can compass about the vaginal examination
Mhm.
or a rectal examination, depending on what the patient's symptoms are. So I'm saying this about like almost like 7, 8 years back. Yeah, I had a patient, and then, I was explaining her that I will step out of the room. You can undress from bottom down. Yeah, I have an extra sheet, and, like the general. And she's like, "What are you going to do? And then
Mhm.
why would you do that?" So that's how now, and then, every patient is, you learn from that conversation that you don't want to assume that people would know what pelvic floor therapy, would look like. So,
Yes.
so I learned one of my life lesson from that I cannot assume things, and I have to educate my patients that pelvic floor it's going to be, I'm going to be respectful about their choices. There are a lot of women who would say, yeah, no worries, that's fine, we can go ahead and do examination. But there are some, female population who are reluctant, and then again, as a pelvic floor therapist, I have to be very respectful of those choices.
Mhm.
So yes, that was, my memory about the pelvic floor. But again, that's one of another big topic, which is again close to my heart, which I love to talk about and educate my patients, is like how you mentioned about pelvic floor. So this is the vaginal opening, and then most of the time when the episiotomy or the tear, right? Like
Mhm.
usually it would be like around this
Just a little
area,
bit. Right.
or like a little bit to the angle left, or so that is usually like the typical way. But everyone, we say, oh, I had a grade 1 tear, grade 2, 3, 4, depending how the delivery, vaginal delivery was. So then what happens is, one of the, this is like the postpartum journey, like pain with sex, pain with initial penetration. That is, and then, when I'm talking about later, the menopausal changes, the tissues get like so paper thin, then it can be cause of pelvic pain. So, think about it is like those tissues, if they are kind of, if there is a cut, then this is how the tissues are. So, scar formation, everything happens. So that is also, it's a muscle. So it happens exactly the same way how if someone would have a cut or a tear in other muscle, which you can actually see, this muscles we are not able to see. So that's where we just feel. And that's one of another thing which people talk about, like women, they say, oh, I am so glad that I'm coming to see you, because all these years I felt that it felt it was in my head. And then everyone keeps saying that, oh, after the baby it will get better, or oh, this is perimenopausal changes, oh, it will get better. So I always educate my patients, it's never going to get better unless you address it. You have to seek a consultation from a pelvic floor therapist, who would, with their consent, do an internal examination, feel for the tissues, right? Like, if this is the muscle, if there is tension, right? Like, you feel for the muscle tension. If I say go to a orthopedic physical therapy and I say, oh, I'm having like shoulder pain, neck pain, then, the physical therapist is able to assess the muscle same way a pelvic floor therapist is able to assess the muscle, know where the tension is, and then work through that muscle tension. And then there are like different tools which we will come, I'll educate in just few minutes.
Okay, so you say the muscle. So, like, if you used your diagram, where are you talking about as far as if you're so
So
if the
this is
muscles are weak, that's what
or
you
yeah, the muscles, they get tight, and then
they
there
get
is
tight.
tension. There is tension. In a in a if I have to kind of, differentiate or like educate, if there is pain most of the time, and the reason I'm giving this in a general bracket, because I don't want people to take away any incorrect information, because every patient is their own snowflake.
Sure, sure.
So that's how I always tell them. But, most of the time, not all of the time, but most of the time, if there is a pain component, then it is like that tension or tightness. And then you can change, it's the right side of your muscle and the left side of the muscle. So same way, your left side of the muscle and the right side
Okay.
of the muscle. So it might be, and that's what it is called as, like, this big, it is called as pelvic clock. So it is like 12 o'clock here, 6 o'clock close to the anus, then 3 o'clock and 9 o'clock. So that's what the assessment it goes, that's what how much assessment it goes into. that is there pelvic tension? Is it on the left side of your pelvis or is it on the right side? Which muscle is tense? And it might be, there are like so many different kinds. There are like three layers. So it might be, is patient is having pain with initial penetration, or if they're having pain with deep penetration, or do they have another big reason where a lot of patients who come for pelvic floor therapy because and that is my journey into pelvic floor therapy is about the recurrent UTI. Women, they feel like dull, aching, boring pain, lower abdomen. Then it was like, I felt like a UTI symptom, but it came back negative almost like 90% of the time. And I just felt like, oh, I have UTI. I don't have UTI. I should take cranberry juice. I should not take cranberry juice. I just got into this zone of where even if I was traveling for a week, I would call my PCP and then just say, like, because, it was like I was in under her care for so long that I would be like, can you please give me medication? What if I'm away? So, think about like the reason I'm saying this, because that's what patients with pelvic floor dysfunction, they always are into that stressful mode that when they're going to hurt. So it would be like one day I'm feeling fine. And then that day I feel that, oh, wow, I don't feel any pain. So as if you're waiting for the pain. So these are all the different, like, pelvic pain components which someone goes through, and it's very important for a health professional like me to the I would say half of the battle is won when they feel that they are heard, when they know that it's not in their head, when they know that they're not making up excuses to stay home or not to engage with their family. So these are like, very important aspect. And I feel since I have been in this journey, when I tell my patients I know how it feels, then it's not like I truly know how it feels because I have been into that traumatizing and, events for several months. So yeah.
So, what is the difference between, I guess not the difference, but what are the side effects of the menopausal aspect of it? And now you say that is that still pain? Like, do you get pelvic floor pain during menopause, or maybe you could explain the difference there?
So I am into the perimenopausal phase. So the important aspects which women need to look into this current stage of their life is needs to be like a holistic approach about their, like, let's talk about the musculoskeletal aspect of pelvic floor. So it can be, like the estrogen, progesterone, like all the hormones are like going, right? Like, like they're like dipping down. So pelvic floor weakness, meaning when patient, they have like stress urinary incontinence, leakage with sneezing, coughing, laughing, jumping. But that's another important thing, which, a lot of women, they come and they're like, yeah, we have been doing Kegels for all these years. Or, again, this is like saw Dr. Google, or like I read with Dr. Google that you just stop the urine flow in midst of the urine,
Oh,
or and then that will tell me how strong is my pelvic floor. Or the new thing in is like, okay, sitting on the Kegel chair that will make your pelvic floor strong. So these are all the myths which are marketed to us. But we as women, we need to be our own patient advocate. And again, seeking a pelvic floor therapist, assessment, because again, it's not that someone who has incontinence or leakage will always have weak pelvic floor. So I'll tell you a very, because patients are like, what? What are you saying? I would always say a tight pelvic floor can be weak.
Mhm.
So the example which I give is like, think about this is like you have 100% range in your, uh, if I have short, right? And this is like 50%, then I don't have the strength. This is the only strength. So think about if your muscles are tight and you're doing Kegel, then it's not going to get any better because you're just doing, and you might make it worse because your muscles don't know how to lengthen. Because Google doesn't tell you that, it just tells you to, okay,
Do that.
Kegel, 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 but it doesn't tell you that you need to relax as well. And again, in all these years, me working as a pelvic floor therapist, most of the time, women they are not doing the Kegels the right way. Instead of squeezing and lifting up what's needed, they think they bear down. They think they are like pushing down. Most of the
I remember doing that when I was doing my physical floor. I can't say that.
ther
Pelvic floor
floor
physical therapy.
therapy
Um, I remember them measuring like how and they would know. They're like, okay, do a Kegel. And I'm like, I'm doing it. They're like,
get.
no, you're not.
No, you're not right.
Yes. So I think that's probably so many people who think they're doing it and they're not doing it.
They're not doing it
Yes.
because, again, it's not just like visually assessing your patient. I am doing the vaginal examination. I have my finger on that muscle, and I could feel if I feel the squeeze and lift, which is needed, or do I feel that someone is just trying to push it out? And that's how, because if I am sitting on the chair and then doing the squeezes, I don't know if,
Mhm.
if I'm not a health professional, if I'm doing it the right way. And again, a lot of it comes with, again, like the food and nutrition habit, coming back to constipation. When someone is constipated, what they tend to do is strain and push down. So there is that musculoskeletal dysfunction, meaning confusion between your brain and muscle, that it can differentiate that if it is squeezing and lifting, or is it bearing down, or doing exact opposite what is needed. So at that time, patients, again, like, remember, like how I told you, the function of pelvic floor is to support. Now think about that hammock that you're pushing, keep pushing down. So then initially it was weaker, and now patients end up with a, bladder prolapse or uterus prolapse, or like the combination. So that's another, unfortunate things where women, we don't know how to take care of ourselves. We always have our family, kids, our loved one first. But this is the, I would say, a lesson, or this is an education which I wanted to have across every woman out there, that take time to know what's going in your body, and then take ownership, and then seek help or assessment, because everyone needs pelvic floor, believe me or not, at every stage of women's life.
Yeah, it's because I also had bladder surgery.
Correct.
I also had the like the sling put in.
Mm-hmm.
And because same thing, I think from all the stuff with my son being born, and then the surgery, and it just kept getting worse and worse and worse. And I had done the physical therapy, I had done all that stuff, but as I got older, the worse that got. So it got to the point where I had to do something about it. And so I had ended up having to get the surgery. That was years ago now, but it definitely helped. I mean, when you are in your 40s and can't hold your bladder, that's embarrassing.
Correct, yeah. Then it comes with lot of like, with the menopausal changes, like the tissue thinning is happening, not enough of estrogen. Then pain is also one of the important aspect. And the other thing is like the urgency and frequency
Mm.
where someone like they would report that, oh, I have to use the bathroom. Like in my office, people make fun of me that her cabin or her table needs to be right next to the bathroom.
Yeah.
Or when I enter mall, the first thing I look is where is the
Where is the
bathroom,
bathroom?
right? I exactly know where to park and where to go because it's the urgency and frequency. And that's when, like food and nutrition comes an important aspect with along with pelvic floor therapy. So according to pelvic floor therapy, the musculoskeletal system, the muscles are part of it, but it needs to be combined or collaborated or integrated with body mind connection and then food and nutrition. Because again, like with constipation, like mostly what I see in today's generation women is like everyone wants to be like size zero. Everyone wants to fit into that dress. So everyone is counting their carbs and protein and then fat and then how much they are exercising, but not taking enough of time to know about their fiber intake, about their water intake. Are they hydrating themselves? So that's when, again, or the urgency and frequency is like the bladder irritants. So again, it all comes with this trendy reels and Insta reels and everything, right? Where people are like, oh, I drink lemon water every like throughout the day. So the portion of it is like, yes, you should have warm water with lemon or lime the first thing in the morning. It facilitates fat loss. Maybe there is something, but it doesn't mean that someone should be consuming like lemon water throughout, and that it causes like bladder irritation. And then it's like the bladder becomes your boss and it keeps telling you, okay, you need to use the bathroom now. Or like someone, they would say like, as soon as I park in my garage, that's when I have to go. I can't, it's
That's my
so
mom.
right? So these are all like, and then it happens, right? Like what they are consuming, hydration level, bladder irritants. So these are another important aspects along part of pelvic floor therapy.
You said warm water first thing in the morning?
So this comes with my, I didn't talk about the later part of my journey as from pelvic floor therapy to a holistic Ayurvedic advisor.
Yeah, that's one
Uh,
thing I was going to ask you is what the difference is.
what happened was, like pelvic floor therapy, me working as a clinician, everything was going very well. It has been almost like 4 years. So I was like I'm 44. I was, I think in my, or like just 40, I turned 40, and I still remember that day. It was November 19th. So my birthday is in June, so like just after I turned 40. Um, I always tell this story because I feel it's very empowering, educational story. I love my husband and he is wonderful. However, that day on a cup of coffee in early morning, things didn't go well how it's supposed. And I remember, I don't remember what went wrong in the conversation, but I remember I was in rage of anger and I just threw a cup of coffee on the wall. So my like people's perception about me is I'm a very calm, quiet person, right? That's what I come across. But here I am, that it was like rage of anger. And then it was like I threw that cup. The best part was there was a person in the house who was doing the cabinets. So I was like, okay, thank you so much. Are you able to paint my wall too, so that I can take care of this coffee stain? But to tell, it was like I could tell, like, and it was like again another very important, like, easy things which happen in every household. Oh, don't talk to mom, it's her periods are coming, or stay away from her, or like this is a red zone, right? Like
Yeah,
these are all the jokes which happens in
sure.
everyone's, right? Like, and then but at that point, I was like so ashamed of myself
Hmm.
that I'm like, yes, I can tell that these are the menopausal changes which are coming, but I said I can't be the worst of myself for me and my family. And then I need to take care of this. So that's when I felt the need to have integrating the East meets West concept and integrating the holistic body mind connection. And I started to look into different options, and that's where Ayurveda found me, I should say. So it's a 5,000-year-old traditional medicine which talks about preventative. So it talks about, like, daily routine, about good healthy lifestyle, how you should, and that has helped me a lot with integrating that in my practice as a pelvic floor therapist, because then it's pelvic floor, working on the musculoskeletal aspect, food and nutrition. The third important aspect is, like, working on that anti-inflammatory, like things which we all have in our kitchen, to use it when needed. Like when you use cumin water, when do you use mint, when do you use those pomegranate, aloe vera, when do you use the castor oil? So, like, and then breathing, yoga, meditation. So these are like all the different pillars which I feel needs to be integrated in the practice to give a holistic approach or for the patient care. So that's what the coffee cup came in. But right, like, it is like we all can, resonate with this, that
Sure,
you,
absolutely.
right? Like, we can tell when we are getting our periods, like a week before, right? Like the sleepless nights.
Oh, yes.
Right,
Oh,
like that's another important aspect, is like with menopause, like with the changes in the hormone, then you're not able to have a good sleep, and then the next morning someone is like irritable, and then the entire day goes, and then it is like, oh, periods are coming, and then it is just like, just like that snowball effect which is happening with all of us. And that's why I wanted to take ownership of this big issue which is happening among all of us in this society, and how to help I think it starts with me first. And it's not that I don't have arguments, but I have not thrown a cup of coffee on the wall after that. Yes. So that was a good start.
we all have our thing, that's for sure.
But and I'm very grateful that I have a really supportive husband and my kids. But not everyone have this option, where they have to kind of, get themselves together and keep going. So, it is for everyone out there to know that they're not alone in this journey. And then if they know, right, it's all about knowing that which hormone at what stage of your menstrual cycle is going, what to expect, which kind of exercises we need to work on, what is the diet, what would be the sleep, when to expect, like, so that you can take help of, for example, when, like, everyone is again different, but for me, like, just like a week, it takes almost a week before my period. that I start to have like that disturbed sleep where I just feel that I'm sleeping, but I'm not going into the deep sleep cycle.
Okay.
So that's when, like the holistic medicine and the food and nutrition comes in, where golden milk is one of the important aspect
What is it?
where golden milk. So a cup of milk, or if someone is, if they can't have regular milk, they can have
Mhm.
almond milk
Yeah.
and mix turmeric powder.
Oh,
So I can, once we are done with the podcast, I will share few of the resources so
okay.
you are able to share with everyone.
Yes.
So it again, it all depends how much turmeric. Just because it's good for you, that doesn't mean you keep adding like 4 teaspoon of it. It needs to be just enough, like a half teaspoon, and little bit of like black pepper, because again, it's all about the chemistry. Turmeric can only get into your system if it is supplemented with the pepper. So, and then someone will have a nice, restful, good night's sleep. So, when
Oh,
I start to, when I know it's time, so it's you should be having, golden milk every night. But if there are times where I don't want to have every night, but I make sure a week before my period, I start having this golden milk, so I am having a restful sleep. So this is all it is like. Just you need to know, like, the focus is for us, for me, is to educate about the different hormonal levels to my patients. So they're like, okay, I need to start my golden milk, or they're like,
right.
right? They're like, these are the different aspects which needs to work on.
And so when people come to see you, are you a mixture of East and West? So you're a little bit of both. How do you decide when to give them some more holistic things or when to do the more scientific is that the right word? The more science.
So, because there was a science for this 5,000-old traditional medicine as well, but I'll just pick like, three examples, and then so top three, which usually are, so one of the important patients who I take care are the pelvic pain. So, perimenopausal, menopausal, or they have like IC, meaning, painful bladder symptoms where they feel that they have that dull, low aching pain all the time. Or like, in a nutshell, like a pelvic pain patient. So, after the assessment, depending if I see that there is like tension in the muscle, correct? So, then pain is always equals to inflammation. So then I work on releasing the tension of the muscle. Then there are like different tools which I would like to share. This is called as pelvic wand. So I always tell my patient that it should not be and this is dilator. So there are different, different sizes of dilator. So these are different tools which help to reduce the tension. So the goal is not, they should not be dependent on me all the time. I need to work with them. I take the opportunity to educate them and then teach them with these different tools if needed, and then they can work on their own at home. So then the first is, again, with this is working on the musculoskeletal aspect. Then working on again inflammation, because as you know, pain is equal to inflammation. So when there is inflammation, then you work on anti-inflammatory diet, you work on anti-inflammatory tea, which you can easily, get some, very few ingredients, or I tell, oh, just get this different tea options from Amazon or any other local store if they want to, because there are like working women who are not able to do their home, like, herbal teas all the time. So there are always very good local options out there as well. So that's when the food and nutrition comes in. The third would be like the breathing. because it's always the body mind connection. There are like a lot of different breathing techniques which I educate my patients so that they are able to have that good body mind connection. Then there are different breathing patterns, right? Like the 360-degree breathing, how to do the good, uh, breathing technique. So, working on those different aspects. And then I also educate my patients about like different like recipes, so that it's not just me telling them, okay, just get this off from the store, but it should be part of their lifestyle. So that's where, like, in a nutshell, and then stretches. So these are important aspect when I'm working, a patient with pelvic pain. And the last but not the least is there are different herbal oils which I tell my patients that this is what I am using, and then teach them that, okay, so you need, and then very simple ingredients like ginger and then, cinnamon and all those different oil based, which are easy to find in the local stores. Which, so it is like, it's like everything together which I feel I like to integrate. That's the foundation, which, so and again, I'm always respectful of my patient's choices because there are times where patient is, I don't relate with yoga or it's not for me because I find it too slow or boring, right? Because I work with teenagers too, like pediatric patient, and they're like, no, Dr. Renu, I don't think this is for me, and which is okay, right? Not everything is for everyone. So this would be like, a pelvic pain patients. Then when it comes to like incontinence, like leakage issues, correct? Then it mostly, then at that point, again, depending on what the patient needs, apart from like strengthening stability, core strengthening, their breathing, at that point, if that's something, again, it comes with, do they have constipation? Are they bearing down? So if I just keep working on the strengthening and every morning they're on the toilet straining, then my important focus is not strengthening. My important focus will be on the root cause because the root cause is the constipation. So working on their, right? So
Mm,
their water and fiber intake. So again, food and nutrition is big part of my treatment. And then when it comes to like, menopausal, there are times where patients they come who are not able to sleep because of the hormonal changes. Then one of the important aspect is like vagus nerve stimulation. So, that's your calming, relaxing, happy nerve. So sorry, like I work on the patients where, and then teach them all those, as best as I can, what they're able to do it on themselves, have that. So, someone can say is, oh, vagus nerve stimulation. Someone can say, oh, it's the techniques, which, so as long as, patients, so that was one aspect. Food and nutrition is again very important because that's would be like a moment for you if I tell you this, that according to this holistic medicine, every food has its own quality, meaning someone, if they are having like, lot of airy foods like popcorn and chips and salads at dinner time, then they feel that, oh, I'm having a healthy dinner, but then they don't, especially in the menopause stage, you need something warm, unctuous food groups. So if there are times where I change the food, like I said, okay, if you like salad, have salads at lunchtime, but at dinner time, let's have some porridge or let's have soup. So food nutrition is also gets an important aspect, and there are like different stretches or meditation technique or yogasana, which helps to facilitate and then get you into that sleep cycle. So, like these are all the different, like three examples which I wanted to share, but they're like, pregnancy, postpartum, they're like, like all those aspects. But in a nutshell, I wanted to share how the treatment looks different.
Yeah, I mean, God, it's so involved, and you just don't realize how much it is.
Correct. Yes.
And so many people ignore this part.
Correct. Yes, very true. And so I feel like food, nutrition, body-mind connection should be integral part of, pelvic floor therapy because, like as I said, like I was a patient when I had all these symptoms, right? If someone would have taken the time to assess me and work on the vagus nerve stim, work on calming and relaxing, work on the musculoskeletal aspect because my pelvic floor was tight, so I used to be always in the stressful mode, and that's why it took so long for my back pain because people is like, oh, you should be good by now, but I was not, because that one aspect, important aspect, was not taken care. And that's why like patients, they feel that they are not being heard, or it's in their head. It all comes down to knowing your body and taking help for yourself, at that point, because you have to be true self for yourself. Because if you are in pain, if it's not your true self, so you have to always go back to who you are and work for that.
So your back pain was all due to, well, maybe not all due, but was majority was because of your pelvic floor,
Floor,
your
I
actual
was like,
back.
because I felt like, after the first accident, the second was just within 6 months, and then the third, fourth. So my body always anticipated pain. When I used to get in the car, I was like tense and stressed, which
Oh,
I did not realize,
yes.
to a point where most of the accidents is like, if I am in the center lane turning the left, or like, if I'm at the stoplight, to the date, because there two of them were like, someone hit and run from when I was at a complete stop. So those two have still, I have to still work through it, because I always keep looking in in the mirror, if the person right behind me, if he's stopping or not. So, these are like, everyone would have their different journey, but if someone has been in any abusive relationships, or if someone are in any stressful work conditions, then they are always in that stressful situation where they don't know, and the only thing they would feel that, oh, I have pain. Or women who feel that, oh, they are going to leak with sneezing, coughing, so they, stop doing things and, working out or exercising. Because
Right.
again, you're fearful of doing things which might cause you to leak. And the
Yes.
best thing which everyone does, like, oh, I'll just put a pad and I'll be okay. So those are, I feel it's taking ownership of your health, being your own patient's advocate, and then going back to your true self and not into that fearful mode that, oh, what if I do this, I'm going to leak, or I'm going to have pain, or I'm going to be in rage of anger because of the menopause, or I'm going to have back pain, or like picking up my baby, or those are all the
Yes.
things which at different stages of women's life, like pregnancy, low back pain, right,
Yes.
butt pain, like these are all the things, right, which, and then pregnant, like postpartum, feeling of heaviness, the prolapse, something falling out, it's all, so they're like, and then like all through this journey. So that's why I always feel everyone needs pelvic floor assessment, and may not need pelvic floor therapy for like extended period of time, but just to know that what would be beneficial. So that was an important aspect.
So if someone was listening to this and some of the things that they may be feeling that they would say, "Oh my gosh, I need to go to see pelvic floor therapist," would be if they feel like something is falling. I know someone who literally I don't know if she still does, but has that where it just felt like everything was coming out. And so someone that has that feeling or pain and discomfort, like a dullness you said, um, pain pain but no UTI, right? Is that what you were saying?
Correct. Yes.
Um, and what else? What would be some other
So
things?
So one, like if I have to do the bladder, that's how I like do it like separately. So bladder, it can be stress urinary incontinence, meaning
Oh, yeah, yeah.
leakage with sneezing, coughing, laughing,
Yes,
or
yes.
it can be urge incontinence where someone feels the strong urge to use the bathroom and then they are not able to walk to the bathroom because they just kind of, go fast and they leak. Or there could be mix where someone has a stress incontinence and leakage with urgency as well. Then it might be like the urinary urgency, urinary frequency, fecal incontinence, leakage, or like constipation is another big one, prolapse, feeling of heaviness, low back pain, or hip pain, which is not getting better. But there are times where they say, "Oh, I have been in physical therapy so many times, but I'm not feeling better." Because there is one of the muscle, which is the hip rotator, which is inside your pelvic floor. And the only way to, reach or work through that muscle is doing the, vaginal examination.
Okay.
Someone who has, again, when I have to be very careful when I say endometriosis pain,
Mm,
because as a pelvic floor therapist, I won't be able to treat the endometriosis.
sure.
However, whatever the pain they have, rectal pain, that's another important pain with sitting for a long time, or tingling and numbness around vagina or your urethra, or like like just they feel that when they're sitting, they feel they're sitting on a burning,
Mm,
you know charcoal, or that nervy pain which someone might feel. It can be like pregnancy, like, tension, low back pain, pubic symphysis pain, meaning like, like when someone has like pain like right in front during the pregnancy,
okay.
or postpartum, like episiotomy when someone has tear, like, grade 2 or because that would tell them that they have some kind of weakness and it's not going to get stronger. Because think about it, if someone has an ankle fracture or weak, right, it's never going to get better unless it's addressed. So that muscle is not going to get stronger as you get older. It's going to get worse or weaker as you get older. And then last but not the least is like in the menopausal, like, working on the strength, because we don't have the support of the hormones. So at that time, we have to work, for the holistic, like food, nutrition, strengthening, knowing your cycle and getting educated so that you can make decisions for yourself, because we didn't get into the whole estrogen and the like topical extrusion. But they're like, all those different aspects which a pelvic floor therapist is going to educate someone for their happy, harmonious, strong pelvic floor.
Wow. Yeah, I mean, good point too about, someone fractures their wrist or their ankle or anything, they go to physical therapy. They wouldn't think of walking around and
Right,
with that pain without physical therapy is always the answer. And then,
right.
but you don't hear people doing physical therapy for things like that.
Yes,
It's
pelvic floor.
yeah.
Because, unfortunately, the way we are, nurtured, or how the thought process is that this is part of the physiological, or this is the journey of a woman's cycle, and these are expected to happen. Correct?
Right.
So no one talks about it. So that's another important conversation which everyone needs to know that, if we are in, because a lot of it comes down to research. The research says like, close to 70 to 80% of the women have some form of pelvic floor dysfunction. So if there are like 10 women, at least 7.5 or say 7 might have some form of pelvic floor dysfunction. No one talks like, oh, when I sneeze or cough, I leak, right? Because you feel, or no one
Embarrassment.
talks about,
Right.
oh, I am like, as I'm aging, I'm not having good bowel movement, I have to strain. Like, no one would say, like, oh, I'm having pain with sex, I don't know what to do, right? So we talk about which purse you got or which makeup you got, and then, going to massage or like, all the external
Yes.
things. But we don't talk about all these important aspects, even with our, like friends. Right? Like these are topics are never discussed among anyone. And then menopausal, right? Like no one would talk, oh, the tissues feels different, or I have an odor, or like, all those very sensitive things.
Yes. And that's why I love doing this because I want everyone to speak up for themselves. And I'm sure there's going to be people listening to this that never even gave it a thought about
Right.
about the physical. I want to say physical floor physical
Ther-
therapy,
Pelvic
pelvic floor physical
floor
therapy. I'll get it.
therapy.
I'll get it. I'll get
Correct. Right, right, right. So no, it has been amazing. And then that's what I absolutely love to do it because through my own journey, I felt how difficult it is for someone who is going, mine was like pain and then all the other aspect, but physical pelvic floor therapy has like so many different components to it, where the biggest thing is you're not able to see which
Mhm.
muscle is being affected, and that's why the biggest thing it's in your head. That's the biggest thing. Or it's okay to have this is just is a passing phase and things will get better. So,
Right, agree. Now, does insurance do you take insurance?
I am out of network
Okay.
clinic. I don't take insurance, and the important reason for this is my vision for my practice was integrating East meets West concept.
Right.
So I won't be able to deliver what my vision is
Right.
because insurance doesn't cover
Mhm.
all the food, nutrition, body mind connection, and all the aspects which I want to treat my patients with.
Mhm. Mhm.
So, but I do offer 30-minute free consultations to my patients
Okay.
because, or so either a Zoom or phone, or they're welcome to come to my clinic because again, my goal is that they should find help. I mean, I
Mhm.
would love to help these patients if they come to me, but the goal is to at least have this platform that women needs to be educated what is happening to them, right? Now they will look back and then feel that, okay, like me sneezing and then having a drop on my underwear is not normal because we
Right.
normalize these things. Or I'm just going to just squeeze a little bit when I'm having initial pain with penetration, but it will just get better. Or I just need to push a little bit to have constipation, but it will just get better.
Mhm.
So these are like, small things, right? Like nothing. Everyone has these things.
Yeah,
So
it's just,
it's
what's the end of the line for people? When are they done dealing with it?
correct. And then before it's too late.
Exactly, exactly. Well, I will leave your information, how to reach you, where your office is, your address, your phone number. I'll leave all of that for so people can contact you. And I really appreciate I loved this conversation. It was very enlightening. Thank you for joining me. As always, do better, expect better, and be better. And remember to laugh through it all. Don't forget to check out my Shopify page where you can pick up some do better, expect better, be better, and some laugh through it all merchandise. Link is in the description.